I'm talking to Mark Sams, who was cool enough to get a name with a Q in it. He's like
Hello.
Honey Badger. You know what Honey Badger is?
I know what a honey badger is and the honey badger, but
Yeah, Honey Badger. It's a firearm. It's made by somebody called
oh yes.
Q. Yeah,
Right, right.
Mark Q. Is that a marketing play, or were you originally MARK and you're just now MARQ now? Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. Before we get into this episode of the All In, All On X pod, I want to talk to you about something that I use with all of my patients, Stella Life. Stella Life is a pre- and post-op recovery system designed around something that every surgical clinician cares about, healing that actually works. Stella Life's award-winning recovery kit supports accelerated healing, non-toxic antimicrobial patient comfort, and provides a natural alternative to opioids and chlorhexidine without the staining, without the unpleasant taste, and without interfering with fibroblast activity. Stella Life is non-toxic, sugar-free, gluten-free, and is manufactured in a GMP facility in the U.S. It's a system trusted by clinicians like myself who give it away to all of my full arch cases. Trust Stella Life. Less opioids, faster healing, happier patients who know you care. Oh no. So yesterday you did a full arch and then you thought you were going to pod at like 11 a.m.?
I had the time. I had the time. Oh,
Was it
man.
one arch or two?
It was just one. It was just one.
Oh, okay. You start
Yeah.
at 6, 7, 8? What do you start at?
8.
Okay. Yeah, there you go, man. Good time. You're going to start by 8, sedation, and on a pod by 11. I love it. I love the enthusiasm.
I don't know if the team likes it, and I screwed that one up too, so.
Look, I've been there so many times. I mean, I've done like 12, 13-hour days and then run a podcast at the end.
Right.
Try to jam in a lunch meeting at, 11, 12 after a double arch.
I know, right?
And we just
Oh.
apologize. It's like, oh, sorry, I ran long. No, I ran my normal time.
Exactly.
So this is cool, man. So Saturday morning, I'm kind of running around on a Saturday morning.
Right.
I prepared yesterday.
Uh-huh. I know. I felt bad. I was like, hey, you're fine. Take as much time as you need.
No, I'm not trying to make you feel bad. I'm trying to apologize for my my brain fog right now. Like, where am I? What day of the week is it?
No, I totally get it. Yesterday, I probably would have been the same way. I wasn't tired yesterday. The day before yesterday, I was so tired because I was taking this doctor out, trying to wine and dine him. And, yeah, I guess the week caught away. I think I got 4 hours of sleep, maybe 4.5 hours of sleep the night before. And I was like, geez. I was like, I got to go to bed early. It was Thursday. And I was like, sorry, I got to leave early for dinner because I got a case tomorrow. I got a podcast to do. I need to be like functional somewhat.
That's awesome. You were whining and dining to expand your practice, or what are you doing?
Right. Trying to bring an associate in.
Uh-huh.
I
Another
mean,
periodontist?
correct.
Yeah.
You
I guess
know,
go ahead.
No, it's like if I was younger and smarter, I would have tried to get all specialties. That's what I want to do. I get all the specialties together, but a lot of them ventured out and sold off and things like that. So it's harder to get people together like
Yeah.
that. Do something.
Everybody seems to have their own, their like life just kind of takes toll, the years get away from us.
Right.
Everybody's got their own plan, nobody wants to work for anybody else, but
I know.
they're having trouble putting it together to do it themselves in the first place.
Correct.
It's
I agree. It's insane.
This is you, man. The Implant and Perio Center of Kansas, Wichita, Kansas. Two offices in Wichita.
You know, the story is my his name is Mark with the K.
Uh-huh. That's
and he
cool.
and he's junior, so my mom, actually, it was my aunt, she named me Marquez, and I was like, "Mom, why did you name me that? Like, I was supposed to be, like, the 3rd, like, Trey or whatever." And so we thought about switching the name, and I was like, "You know what? I'm just gonna drop the UEZ and add a Q or just keep it Q."
That's cool,
Just
man.
and then, like, you know, girls calling me Mark Q and all this other stuff, so I was like, "Yeah, this is cool."
Any way you can get them to remember you, right, brother? I mean,
Exactly,
that's
exactly.
I'll take what I can get, you know? Well, let's, could you continue your, introduction. 2006, Doctor of Dental Medicine, University of Louisville. You went down to Palmetto, I believe, for
Oh,
perio.
yeah.
Is that 2010? And then, American Board of Periodontology, and then obviously, but you're a recovering football addict, is that right?
Somewhat, somewhat. Um, I played football. I'm from Georgia originally, and
Uh-huh.
that's big football country, and I played football and did all the little state championship stuff and almost like I wanted to go and I was like, I wanted to play for the NFL and I was like, I don't think I'm good enough. And that's kind of like how I'd wind up going down the road of Perio because I didn't take the leap. I had a couple of scholarships. I went to Louisville, Baylor, and those are the bigger schools. And Academy was recruiting me at
Mhm.
that time. And I was like, I'm all broke up from high school and I don't think I'm gonna make it to the league. And now looking back, I look at the biggest thing for me, I was fast, and I was like, "Man, I'm still as fast as those dudes back, that play right now." I was like, "Maybe I could have made it, who knows?"
Yeah.
So, I got a so when I went to dental school, I had graduated, and I had got into a hospital residency, and I was actually walking down the hall, and the dean of the school and the perio, director was in the halls, and the dean of the school was like, "That's your new, resident." And I was like, "What are you talking about?" And I was like, "I already got my thing set up." So I go back home, and I was like, "I wonder were they for real," you know?
Yeah.
And I said, "I don't wanna regret and come back and look back at another opportunity that I, had and regret it." So I went back and asked the, director, Henry Greenwell, at that time, "Were you serious?" He said, "Yep." And I said, "Well, let's get this show on the road." And it was a done deal. I got an Imperial residency because I didn't chase my dream of football.
Hey, you know what? I mean, everything happens for a reason, God lays it all out, I guess,
That's
you
right.
know?
That's right. That's
Yeah.
right.
Just following the dream. I got a I love perio, man. I almost thought about doing it myself. I got
Oh, really?
Yeah, my one of my clinical years, I got their Excellence in Perio Award, a little scholarship in dental
No way.
school. Yeah, yeah. I guess I was good at picking the teeth. Uh, but
Uh,
that was a long story. Just kinda I lost my fancy after a little while, I probably had my mind set on the wrong things at the time,
right.
and, just still developing who I was, but, yeah, I should have followed that along, but that's cool, man, from football. I mean, people from non-traditional avenues into dentistry, football into dentistry, right? Marine Corps
Right.
into dentistry. I mean, you just can't plot that journey. Can you really? Like, you were there ever 6 years old and you said, this is where I want to go?
You know what? Everybody asked me how that story came about. And I was in college, and I think it had to be my junior year, beginning of the summer of I had finished my junior year, and I worked at a gym, and this lady used to come in, older lady used to come in, and she never really said anything. We waved and said goodbye, but I went to the water fountain, and she was like, "Hey." I was like, "Hey," and she was like, "What are you doing?" Like, I was like, I'm going into my senior year." She's like, "What are you doing next year?" I was like, "After school." I was like, "I don't know, something in medicine or I don't know." And she's like, "Don't you think it's time for you to figure it out?" I was like, "Yeah, I should." And the story goes along and she's like, "How about dentistry?" And I was like, "That's disgusting." And she was like, "It's not that bad once you get in the mouth." And I was like, "I don't know." She's like, "What do you got to lose?" And that's how my dental journey went about. I was like, "You're right." And she's like, "Come out to my practice." She was a hygienist. She's like, "Come out to my practice. My doctor would love for you to shadow him." And he's amazing, dude.
Yeah.
Old Jewish guy, John Wiener. And he uh, he knew all his patients. And I like the aspect that you could talk to people, you can move around and use your hands, and, he tried to teach me even though I had no idea what these, meso and distal was. He was like, "Come here, and Imma show you how to do this crown prep. They're not gonna show you this in school." And I just thought he was so cool. I was like, "You know what? I was built for this." So
That's cool, man. You know what? We have a lot of similarities. And for you guys listening out there on the pod, we're going to get into some dentistry later. So stay tuned because we're going to talk about peri-implantitis and all on four practice and full arch. But this is let's continue with this for a second because we have a lot of similarities.
right.
I was in the Marine Corps, went to college, was going to medical
What?
school, was coaching a hockey team, and I in the lobby leaving after losing a playoff game in an undefeated season, exiting early. I was so mad. I was coaching these 14-year-olds.
Right.
No kid of my own on the team. I'm just coaching for fun. And this guy stops me and he goes, "What are you going to do after graduation?" I said, "Go to medical school." "Why do you want to do that?" "Oh, I want to help people. I want to do little procedures, own my little business, be a big part of my community." He goes, "Yeah, you're not going to do any of that in medicine. You're going to want to do what I do." "What do you do?" "What do you do?" He goes, "I'm a dentist." I go, "You're out of your fucking mind." I look,
Exactly.
I go, "You're out of your fucking mind." I go, "There's no fucking way." I'm like, I'm cussing job. I'm like this. I'm like, he's like, "No, I'm serious. Come by my office one day." And I'm like, boom, like this, like
Right.
voice in the back of my head goes, "Why is this guy standing in front of me right now? And why
Right.
did this happen?"
Exactly.
So I go to his office. It's snowing, blizzard in Michigan. I expect them to be closed. And I go, "Where's Dr. Heiss?" I get there, "Where's Dr. Heiss?" "He's outside shoveling snow." I'm like, "You got a shovel?" They're like, "He said to stay in here." I said, "If he's shoveling snow, I'm shoveling snow. I came here to
That's
see
super
him." He ends up being a dean at the dental school.
No way. That's
I
freaking awesome.
had no clue. He was just there watching his best friend's son, who was my all-star player on the team.
No way. That's crazy story.
He goes, I've been watching you all season. I knew you had this desire to go to medicine, but I think, you should go to dentistry." I'm like, I'm gonna come by here every Wednesday for a while until I make a
Right.
decision. But,
That's
you
legit.
know, I don't know. It's like weird. Like, why? It's like a guardian angel, I guess, if you
Right.
think that, if you think about it,
I know. I like
right?
even like coming here, people are like, "How did you wind up in Wichita?" I was like, "Man, I don't even freaking know. I would never in my life. I beat out that whole middle section of the United States. You take me to Oregon, California, Texas, New York, maybe not New York, Maine, um, Virginia, North Carolina. I
Yeah.
mean, but Iowa, South Dakota, Kansas, mark those all out.
So there must have been, I guess, either a mentor or a girl or something. I don't know. What what
You
is
know
it?
what? It was a recession, and I was looking for a job. It
Okay.
was opportunity.
Okay. That's all right. There's nothing wrong with that. This
Right.
is but you end up with, where is this? Where are you at here? I'm looking for your screen. You are uh I was looking for your staff. Um
Oh, yeah.
it's
It's a
quite a
lot.
team. You got a lot of people. And where's
I
this
gotta
picture at? You're
probably
oh, here,
rotate.
probably under the team. Oh, there's a picture of you guys. I don't know. It looks like you got about 20 people in that office.
Yeah, it's like, I wanna say it's 24 of us now.
Yeah. It's a nice, impressive office photo. It looked like, if I could find it, it looked like it was some reality TV show. It looked like the little episode of The Bachelor or something.
That's the look I was going for sure.
Yeah, oh, here we go. Look at all these
Oh,
people
yeah.
here. I'm not sure what this guy signed up for, but who's your partner?
Oh, that was Dr. Sean. He actually just left a while ago, so we need to take him out of the picture. But you know what? That dude's famous. He's a dancing dentist. Look him up. He's a big time periodontist. He actually moved down to Phoenix. He needed to be in the limelight. This is too slow and country for him, I believe.
Oh, I see what you yeah, staff and pictures. I have the best staff in the world, but I looked back at my website a few months ago, and I'm like, there was a picture of the About Us, and there was like
Right.
12 girls, and there was maybe 10 of them were gone, you
I
know?
know, right?
I went,
Probably that picture, half of those are gone, to be honest, but
yeah,
I guess you know, that's a whole nother topic. It's a different day and age from what it used to be when I started, and now, like, people don't stay long, and so you have to change your, training regimen. Like, you
yeah,
have to be way more organized and expect from the leave in less than 2 years, and, I always tell everybody, like, if we keep this whole team together 2 years, we'll dominate because nobody could keep anybody long enough to do
yeah,
that. And so I've had it where I've had people 7 plus years and that was like it. And we're just growing and the new people were because I just brought them in to grow.
mhm,
And I've had it recently where it was like new person every year and a half, every 2 years, just trading them in and trading them out. Some for the better, some for the worse. I mean, I got some going on hygiene school, nursing school, and it's like I push my team to always be better. So I
yeah,
don't argue against those ones.
yeah,
And I also tell some people, I tell everybody when they come into the job, this is unlike anything. If you know what working hard is, it's a whole different beast. And every single one of them say, I just had a girl say she was leaving to go be an office manager, so she was moving up in a position to be an office manager. She's like, "I worked at a lot of practices, but this is a beast." I was like, "I know. I told you when you came in." And so,
Are you looking to attract more full arch patients? SIN 360 is offering a professional marketing video package. Their production team comes to your office, documents a case from A to Z, including patient testimonials and final delivery. It captures an in-office tour, creates a high-impact case study that you can deploy across your website and your social media. The full package, $12,995. Oh, but there's more. It includes $5,000 of free SIN product. If you're serious about expanding your reach and maximizing ROI, email videos at sin360.us. Tell them the All In, All On X pod sent you.
yeah, you know, we have our little core values, but one is hunger, and everybody that comes in, if you're not hungry, you don't last for very long here. So,
yeah,
uh, but it is different dynamics than it used to be. It's not as much loyalty, which is fine, and people are moving and feel like they gotta go other places, but,
yeah,
uh, it's a good ride. I like to see people grow, and like, people are like, "What do you like the most?" I'm like, you know, I do all these cool procedures and I help people out, but it's the people that you're with every single day you're with these people longer than you are with your, family, so it's like, I've
mhm,
seen people have kids and, like, move up into different positions. I had this one young lady that was a hygienist. She went to go play professional golf. I mean, it's like you
yeah,
get to see these dynamics with individuals where they're 20 and now they're like 35 and they got kids and they're growing up and their party stages are over with, or somebody that was super motivated, aggressive, move up in the business. And it's just a beautiful thing. I just love seeing that
yeah.
component of it.
Yeah, you said a lot of things that are similar to my life, parallel in my staff or my journey and my philosophy. But the the staff, for 10 years or more, I used to beat myself up that people would leave in 2 or 3 years. Like, what am I doing wrong? And patients sometimes would say, "Hey, I don't know anybody at the front desk anymore. What'd you
Yeah.
do to what'd you run them off?" And you're like, "I
Yes.
treat 'em really well. I pay them really well. I treat them really well." But, life happens. I mean, I'm in a Navy community, first of all, so
Oh,
you lose
okay.
a third of
Def
them when their husbands transfer every 3 years.
I've had that
Uh
too.
a lot of people, I put people into dental school or into other professions, found things
Right.
they wanna do, we've helped them grow, and then a lot of people, I think the human nature, there's this element of people just get tired, grow hungry, grow thirsty, want to find something else, and
Yep.
they're like, "It's time for me to move on." 3 years, I think that's a number. But
Right.
why? You're like, "I don't know, I didn't see what else is out there."
I know, it's the craziest thing.
You're like, "Okay, well, I pay you well, it was
Right.
regular, you understand the job."
The
Half
biggest
the time they call you up in a year or 2 and be like, "I never should have
Yes.
left."
That's the biggest win right there. I was like, I love when it's like I always tell them, "Don't make a sideways move. Don't go somewhere for $1 or something like that, like, or
Yeah,
whatever." I mean, make sure it's, like, substantial, and I could cheer you along though for that.
yeah,
But the biggest win is when they come back and you're like, "You know what? That was a really good practice," or,
mhm,
I have had some people say, "Hey, can I come back?"
yeah.
And it's, for whatever reason, and it's like, "No, I can't really do that." But, that's the win is when they congratulate you and they realize, "Okay, that was a good place," or they're like, "Hey, let me come back."
Yeah. I went to a big area Christmas party this last year, oral surgeon put on, and I saw at least 3 or 4 former employees that left, and some of them left because they kinda just went cuckoo, and
Right.
they all were like, "Can I come back? Can I should I?" And I was like, I also don't date ex-girlfriends."
Right, exactly.
So, it's not
That's the point.
it's not you, it's me. All happened for a reason, right? You know?
Right,
Uh,
right.
that's
It
cool.
never
When I got
works out.
Yeah. But culture is a huge thing, man. I'm writing this morning, I'm doing a business seminar in a couple of weeks, and I'm rewriting
Right,
some of the systems. You were talking about systems and culture, and I'm rewriting
right.
my presentations, and that's huge because if you gotta replace a staff member every 2 years, you
Yep.
better have systems and a culture in place that just kinda grooms that new employee and helps
Right,
bring them
exactly.
on board, or else you're bad, man, you'll never get anywhere, right?
It's difficult, like, I think we have enough players and core people that's been here. I mean, I just actually saw this lady, she retired, she was here for 30 years. She was longer here than I was. She was here for 30 years, and I have another lady, she's 28 years, and I think like the core, if you got like out of my team, I got 24 and I got like 6 or 8 cores and
Uh-huh.
they're able to maintain it. And I recently lost my lead to she went to nursing school and 2 assistants. And so I have this new like hungry clinical lead now, but I could see her like fighting, struggling, trying to figure it out.
Yeah.
And she's figured it out, and it's hard for me to, like, back off. I'm not gonna back off because this is what she has to go through to, like, be what she needs to be. And so she's, like, fighting all these different things, learning all the materials and learning how the process is supposed to go, but also learning how to work with people. And, no, it's a new clinical team. I got some older clinical team there, but it's like I got so many new people now that I'm having to like implement. It's not just them getting inundated with all the knowledge from other people. It's like, okay, now you got to hear it from me, which
Yeah.
I'm sure they don't like one bit.
Yeah. This is what I was talking about. I mean, I do this once a year, a 2-day, thing, and I'm gonna open up this 2 everyone's gonna come and ask about marketing and advertising, but I'm gonna spend the
Right.
first 4 hours talking about team building, culture, SOP, systems, ORM, CRM, KPIs,
Oh no.
you name it, because everybody comes to me and they're like, "What how much do I spend per implant?" Or, "How much do I spend per arch?" And, where do I advertise?" And I'm like, what kind of systems do you have in
Right.
place? You know?
Exactly.
It's wasting your money if you don't have that, right? So,
Yeah. You run off the EOS system.
I run off what?
The EOS.
Oh, yeah, we got systems on systems. That's We got systems on systems. ORM, CRM, yeah, everything is KPI, like how do
Yeah,
you measure people's success? I mean, people
exactly.
come to you and they're like, well, I want a raise. I've been here a year. And it's like, well, let's look at your numbers,
Yeah,
let's look at your success. You know,
correct.
being here another year doesn't mean you get a raise.
Exactly,
Yeah.
exactly.
So this is how we got into it. I got it. So I read this. I was into Dental Town. I read this article on the laser approach to peri-implantitis management by Marq Sams. I'm talking to Harry Herring, and I'm like, "Hey, have you
Right.
ever heard of a guy named Mark Sams?" He goes, "Yeah, I saw him speak. He's phenomenal. He's a really
Right.
good presenter, and he's funny. He had the audience rolling." So I said, "Good. I want to hear some good jokes." I'm like,
I'm not a comedian, my friend.
I said, so my N value is 1. I had one friend, the first friend I talked to that
Right.
I asked about you and he knew you.
Well,
And I
cool.
said, I like this article. Tell me about this. This is let's talk about peri-implantitis. You're a
Yes.
periodontist doing peri-implantitis. Let's talk about it. What
So
is, yeah.
like, periodontists that you treat teeth, but, this day and age, implants are the big boom. It's the norm at this time, and when I was in residency, I told my director, I was like, "I wanna learn how to treat, peri-implantitis because it's gonna be a thing and everybody's placing implants, so it's gonna be even more of a thing to be able to treat, maintain, and, try to save and to, replace."
Mhm,
And so that's always been a big thing of mine because I knew that that was going to be the new area of focus. It's like its own little niche. And so with treating teeth and versus treating implants, it's a significant difference. Like it's way harder to treat implants than treat teeth because
mhm.
you got a lack of blood supply, because you loss of PDL.
This segment is brought to you by JB Dental Lab, your go-to partner for full arch prosthetics, zirconia, PMMA, and digital workflow. With a proprietary portal, in-house designers, and an advanced education center, you will experience reliability, precision, and consistency. Visit jbdentallab.com.
You're losing immune cells to heal the site, and the inflammation is way more aggressive around implants.
Mhm,
And so it's like, how do I treat these sites in a conservative, minimally invasive approach that I could get something that is predictable?
mhm,
It's hard to do it with teeth. It's even harder to do it with implants. And it's just my school was involved. It was University of Louisville. It was involved in a multi-center study, and I think it was Michigan. I want to say Rutgers or Tufts, and 2 private practice. The dean of the school at the time was Henry Greenwell, as I said before, and I remember him coming to the class, and this is like my 3rd year, so I was almost done. And he's like, "We're gonna participate in the study so we could disprove the laser." So
okay.
you use it or whatever. I graduate, the study's going on, and I call him up and I was like, "So how's that laser study? Y'all almost done?" He's like, "Mark, I don't know how it works, but it works."
Yes.
And he is one of the hardest core directors, perio god dude that I know. And I said, if he says that, it must work. It must have something to it. And that's when I took off with the lasers. I got it then. I think it's been 13 years, 14 years I've had it. And I've gotten other lasers to supplement it. And so that's kind of the journey. He also said another thing. He was really influential, as you could tell, in my life. He said, the more clubs you have in the bag, the better clinician you'll be. I
Mhm,
don't think lasers are to treat everything in
mhm,
every situation. In certain situations that it has been super beneficial for me. Like I was like, I couldn't do this clinically, and if I did, it would have took so long and caused the patient so much agony.
Mhm.
that I don't know if it would have been worth it, and I would have maybe fatigued out and not been able to get the result I wanted.
Mhm.
And the lasers allowed me to do some of those things, but like I said, it's not meant for every single case. You have to every patient's has to be individualized as far as their treatment. And so
Mhm.
it's been it's worked well when I've used it. Have I had times that it didn't work? Of course. Have I had times that traditional bone grafting and all that didn't work? Yes. So it's like trying to figure out which application or modality is going to be best for that patient.
Sure. Yeah, I mean, I read your article and I thought I couldn't agree with you more on this and laid the use of lasers, but particular wavelength of lasers and in particular circumstances. Would you agree?
Oh, for sure. For
Okay.
sure.
Um, I bought a ER YAG laser, the water lace, I plus water lace, I think in 2010 plus or minus.
Sweet.
The only reason I did it and was for peri-implantitis
Right.
because I bought a practice from a gentleman who's old gentleman from the going way back. He learned how to place implants with Hilt Tatum. He's a
Right.
pioneer.
Right.
You know, and
Right.
our practice had thousands of implants in it with peri-implantitis
Right.
and hundreds at least, hundreds. And nobody knew what to do with these implants. I mean, it was just all anecdotal and, oh, we're going to flap this one and we're going to try to bone graft that and we're going to demineralize bone this and we're going to, debride that implant and polish those. And there was I think in 2010, I don't think there was really SOP. Would you agree?
Curry. I totally agree with that.
Yeah. So
It's
I saw interesting literature on the ER YAG, and I have this I plus still. It's 15, 16 years old. I think it broke once. I had it
really
once. Yep.
right.
Yep. And everyone wanted to use it for the turbo handpiece and make
Right.
crown preps and cavity I just wanted it for implants. That was it.
That's super like you're futuristic in that aspect. Like I don't know any oral surgeon that was doing that at that time to treat it. You know what I mean? That's pretty
Yeah.
impressive.
Yeah. Well, thanks. I'm a GP.
Oh, are you? I didn't know that.
Yeah, I appreciate that. Uh,
That's
I
cool.
I appreciate that. And I'm proud to say that too.
Right.
I wanted to, look, I wanted to be an oral surgeon or a
Right.
periodontist, but I had a baby and I was out of the Marine Corps and I felt old and I was like, I'm just gonna get into it and I'll do whatever the hell I want. I'll just go to
Right.
extra
Right.
training. So yeah. But anyway, um, one thing that's really important, it says here, when appropriate wavelengths are combined with meticulous mechanical debridement and enhanced visualization. Take me through that. What do you mean by that?
So, you have your steps and everybody, I mean, I don't think it's one um protocol that's like set. I mean, I know that the Millennium has the NAP has this protocol. And
Mhm,
with me combining it, I can't really say it's Lanap is anyway, is or Lapip. But Lanap, I try to de-epithelialize to open up the site with the NDAG. And then we use the endoscope, which is direct visualization. And like that component of my practice that I was able to add to it, it's like helped out so much to be able to utilize that. My hygienists love it. And you could get up to 25% better results with that, the endoscope. And so that direct visualization, we've been able to be even more minimally invasive. It's actually cut down on my periodontal surgeries because we're able to treat so many sites effectively. I don't
mhm,
say it, but we've even seen some, I don't advertise it. We've seen some bone growth with the endoscope because you're getting it and you're cleaning it up so well, you're changing the biological response of the patient.
mhm,
And so that's the meticulous debridement that we're talking about. It's hard to get in between those little threads of
sure,
the implant and making sure you're debriding unless you can see it. And so that's, like I said, that's made a big impact not only on the peri-implantitis side, but even my periodontal practice as far as doing traditional treating traditional perio.
Mhm.
Uh, Once we do that, then we could go in with the erbium and detoxify the site. And so you got two lasers that we're utilizing. We got one, the Nd:YAG, that's causing deapple. Dang it, I can't even talk. You know what I'm saying?
It's a
Uh,
Saturday.
Saturday, exactly. I'm off, and so it's keeping soft tissue downgrowth, but also it's treating that bacteria that gets embedded into the soft tissue, which we could forget about sometime, and then that's not treated because it's more light source. The erbium is more water source, and that allows you to treat the surface of the implant without causing damage to it or
Right,
thermal damage as long as you're using appropriate techniques doing that. So you got
right.
one treating the surface, one treating the soft tissue. And so that combination is allow for us to get some nice results.
Mhm.
Uh, we actually just, I shouldn't say just, but we're using ozone therapy as well as an adjunct treatment. And the reason for all this is like the only reason I'm using all this is because I use it in my practice. I would it's hard to tell people unless they have a implant practice
Mhm.
to invest $150,000 in lasers and all this other stuff. I
Mhm.
use this stuff all the time in my practice. This is part of my practice. It's probably 50-50. We do a lot of implants, but we do a lot of perio treatment and a lot of these toys that I have or
Yeah.
being able to utilize in other areas of the practice. Like we got a T-scan. I use that for full arch, but I also use that for Lanap. It's like I'm utilizing them in most different areas, so I'm able to get a return on volume. If you're only doing 100 implants and you don't have that many implants coming through, do not that's the $150,000 on two lasers and
Yeah.
uh, all this other stuff. I was like, if you don't do implants, go ahead and do them, and yeah, it makes
Yeah.
sense.
Yeah. My hat's off to you. I've been looking at an ND laser for a while. I just have the ER-YAG,
Right,
laser.
right.
I just use 2 tips, I'll use like a long, like MZ5 to
Yeah,
epithelialize everything and go down, and then I'll treat the implant, depending on the situation, how to depride that. But then the ERI, do you use that, I use a radial firing tip that with the
yeah,
energy going out the sides. Is that
correct.
is that your
Is-
modality?
Yep. So it's like what I was gonna say is you could use that laser. You're able to use the Nd:YAG component of it. So I have a Photono, I could use that, and I have used both. I mean, I have the Millennium and I have that, and I used to use both.
Uh-huh,
I've used just the Photono as well,
uh-huh.
just because it has everything on it,
Okay.
and so it's not I guess you don't technically have to buy 2 lasers because you could use that component of it, so
If a gal or a guy was to get 1 laser, you think the Patono would laser that? Is that what you're telling me? Would be a good way to
Yeah,
go?
I think
Yeah,
so.
okay.
Mhm.
I think that's important. Or if you're only doing 100 implants a year, just send your people to Wichita, Kansas.
You know what? With those lasers, you could do so much stuff with them, though. I mean,
Yeah.
I don't technically do trial lengthening with it, but I know you could do it. Gingivectomies, you got root canal therapy, you could do it. Caries. I mean,
Oh, yeah.
if
Yeah.
you're gonna use that laser, just don't use it for peri-implantitis. Use it full force and
Oh,
get the
yeah.
value out of it. I mean, you got so many. I always talk to the team about you got the direct use of it, but you got the indirect. That's a great marketing using like up to date the technology as far as the laser. It's minimally invasive. It helps with you got biostim that comes with it. I mean,
Mhm.
there's so many components to that laser that you could utilize not directly just for treatment, but also to grow your business, and so you get a good return on your investment.
Oh, yeah. Yeah, I think it's phenomenal, and I would much rather have a laser used on me, and I've used it for all kinds of off-label uses as well, but, I've done vestibuloplasty with no anesthetic, just topical. Just
Exactly.
you know,
It's insane.
it's a thing, yeah, it works. So young people, you can buy a laser. It's more than just peri-implant. I like what you said. There's a there's 100 indications for use of a laser, easy.
Correct,
Yeah,
correct.
and the endo tips. I haven't done a root canal since 2007, but
Same.
I'm not gonna do one now.
Oh my god.
Um, these are impressive X-rays, though. Going back to mechanical debridement, so you leave the threads on there, use your endoscope, and you, intimately debride every thread? You don't
Yes,
polish and laser?
I have. I've
Okay,
done it all.
okay. What what's the
So,
indication for one versus the other?
you know, so, uh, yesterday, actually, I had a case, or a guy had a full arch case, and, he had an implant. It just wasn't healing up. Um, the bone in between 2 of the implants wasn't healing up, and I was like, "Oh, we're gonna have to get this one out," because it was so much horizontal bone loss. It was the bone defect. We were missing the buckle, bone on the buckle, distal and mesial is a 3 wall defect.
Mhm,
Uh, and so I just like, this one won't work, but this other one we could probably save. So that one, it had horizontal bone loss. So it's hard to get vertical unless you have a vertical defect.
mhm,
So what I did was polish the exposed part that was coronal, or the horizontal component of it, polished that, and then left the part where it was the thread exposed and the defect, the bone defect.
mhm,
And so I knew I could get that part grown back, but I knew the part that was exposed above the alveolar crest, I wasn't going to get anything. So I polished that off.
mhm,
And so that was the time that I polished it all the way down, even though I had a defect. And it's just trying to figure out what works best for, the individual, and, I really
mhm,
like removing the threads because it
mhm,
just removes that component of it,
mhm.
but it's way more invasive. That's when I'm flapping it,
Yeah,
and it's a more of a aggressive defect.
yeah, and of course, you have to
Like,
probably take the restoration off to get a good
correct,
debridement, right?
correct,
Yeah,
correct.
and then how do you feel about bone grafting after laser therapy and debridement?
I've done it that way as well. I've gotten similar results, and so my biggest indication is what the defect looks like. How severe the defect is, how wide the base of the defect is. But so with the laser, it typically grows from underneath, or it grows up, and
Mhm,
when you're bone grafting, it's growing down mostly. So uh, I like to bone graft those bigger defects, the ones that have a wider span,
mhm,
and I'll take off the crown and do all that stuff and open it up. I still use a laser, and we do like scarring of the bone, and we graft that tissue. I use PRP quite a bit. I was just talking to a young lady, the young lady that was looking at the practice about it, and she was like, some of my instructors don't believe in PRP. And it's like, I don't know how it can't be. There's so many studies out there.
right, yeah,
Is it really gonna help with the bone graft? It has a antimicrobial component to it, so it's at least keeping it clean, and it stimulates angiogenesis, and it has
yeah,
veg in it, so it's helping the soft tissue grow over it faster, so you're protecting the site. So it's like, I don't know, but
mhm,
everybody has their own philosophies, you know.
yeah. I don't wanna I believe in PRP profoundly. I was using Harvest PRP in 2003,
Right.
4. I mean, shoot, it cost us like $600 to pull PRP, and we still did it.
I
Now
know.
now it costs $6 or $12.
Right.
Why would you not do it? Um,
Exactly.
yeah, this is an incredible case.
Yeah.
I mean, this implant, I'll be honest with you, I'd look at that before picture, and I would
Right.
just start talking to the patient about pulling the implant out, you know?
We had those discussions.
Yeah.
Yeah, I mean, you
How
know
does
what? Patients come in and they're like, I'm like, "This implant doesn't look good. We got 2 options." I was like, "I could try to save it." I try to tell them, "Yeah, I think I could get this versus that." And I had those situations. I do not think this thing's gonna work.
Mhm,
And, they do not wanna do that implant over a lot of the times. So they're like, "Yeah, I wanna save it." So I'm like, "Okay." And I'm pretty sure this probably was one of those cases.
mhm,
Hey, we could go either way. I mean, I
Mhm.
think as long as it's not past 50%, I'm like, "Yeah, we got a good chance either way."
Mhm.
And, but I give them the choice
Yeah.
and say, "Hey, this" I try to educate them as much as I can about what's the pros and cons. We could take this implant out. A lot of times when you take implant out, so you lose ground. You have to do some significant grafting more than you would normally have to do.
Right.
Uh, and so I tell them about that component. It's not gonna be the same. We
Yeah.
could get this implant and try to save it. The likelihood you're probably gonna have to be in treatment, we're gonna have to watch this thing for years. This is gonna be your problem child for sure.
Mhm.
And a lot of times we'll get results like that. That's why I'm like, how can people not wanna go against the laser? Like, it's
Yeah.
you not you I didn't use anything except for the lasers on those. No
No
PRP.
kidding.
Yep.
Well, debridement, I'm sure, right?
Right, exactly,
Okay.
exactly.
But
The protocol, deepithelialized laser, debride it, then use the laser and just went back.
yeah. So, as so those people that are listening, by the way, you should be on YouTube if you want to see these pictures. Checking this lecture out on YouTube. But this before picture, I imagine there's a lingual wall, and then you got this bone that's on the root, the distal of number 30. That's key, right?
Correct, correct,
Yeah.
also add some little blood supply to the area at least.
Right. Because if you see this implant, and for those that are watching on YouTube, and that bone is not laid up against the distal root of 30, what are your thoughts there? Is it still the
Oh,
same thought?
uh, I've had that, and it never really turns out. It has, but
Yeah.
more than most, it doesn't turn out. I don't know why it is.
Yeah.
It's just not getting enough blood supply to the area. That defect, even if I do get a good response from the implant, the defect on that too never really responds correctly. And I do not know why. Um, I don't know if because of the response to the bacteria in the mouth, and
Mhm.
I mean, I really don't know.
I
Um,
think you said a blood supply earlier. I mean, this is a wall of that defect. So, if you take off this crown and you see basically just a big crater and it's got 4 walls, you're in better shape,
correct.
obviously,
Yes.
right? So this is an awesome result. Your people are gonna ask, and I hate these questions, but people out there right now are like, "What does he charge for peri-implantitis and a laser treatment?" And just in a range, I know you probably don't wanna give your fees over the
I mean, I don't
air.
really care. I mean, and it doesn't matter. We're in Wichita, so our fees are pretty cheap.
When bone is limited, excuses don't cut it. Core Anchorage teaches remote anchorage, zygomatics, pterygoids, advanced fixation strategies for complex full arch cases. Expand your indications, treat more patients, increase predictability. May 15th through the 17th with live surgery and cadaver exercises. Register today.
Yeah,
Uh, I can't really remember though, because I only
yeah,
look at the fees once a year, but I would say probably 1,500,
yeah,
maybe 2,000, maybe.
yeah. I'm
Uh,
like you.
last time I looked at it it's probably 17 now.
Uh-huh. Yeah, probably. Like, I'm with you. People ask me my fees, and I'm like, I don't know."
Exactly, and I truly don't know.
I'm like, "I set that fee," and then every year they go, "Should we raise them X%?" I'm like, or they'll come
Right.
like, "Hey, doc, you're losing money." I'm like, "Okay, fine, move it on."
Exactly.
I mean, I got a little more oversight than that, but, it's not something I look at every single day,
Right, right, exactly. I'm not quoting patients' fees, so
right? Because with that, are you gonna add bone? Did you use a laser? You gonna add bone? Did you have to flap it? Did you have to take the crown off? Did you put a healing cap on? Did you get primary closure? Did you have to do soft tissue grafting on top of that? Like, right there's a whole
right,
it's a big
right.
question.
So, I guess you brought up soft tissue. I guess that's another component because if you look at a lot of these cases is fashion a decent amount, probably 50% of these cases is due to, like, lack of keratinized tissue around the site,
Right.
and that's a huge,
Yeah.
uh, marker thinking implant. I tell patients like, "Oh, why we have to use soft tissue graft? Because you're gonna come to me in about 2 to 5 years, and your implant's gonna be having issues, and that's why we're doing the grafting to thicken out those tissues to create a better, long-term success for you." But I do decently often do, gingival graft or free gingival graft around those sites if necessary, or I'll at least picking out those tissues, but
Yeah.
not every case. I didn't do it on this case.
Okay. Yeah, I think that, one thing, this implant had a couple issues from the get-go. One, probably the connection.
Yep,
Um, like that bone, if you're looking at my cursor, I'm sure when that clinician put in this implant that it was at the level of the bone at the time,
right.
and it probably lost bone to about the first thread in a year.
Immediately, right.
Yeah. And then the rest is just, relying upon hygiene and quality of keratinized gingiva, I guess, after that, if it's
Correct.
gonna develop into anything. Is that about it?
That's about it. You
Yeah.
respect that one, every case is different, and, like, I always tell, the patient, I was like, "You know what? I think we only know the surface of the body, so how you react might not be the same way." I've
Mhm.
had smokers that smoke 2 packs a day and have implants done, and it looks way better than a person that I'm like, "You take nothing. What is wrong with this implant? What did you do? Did you bite on this thing or what?" Like, uh, and sometimes it baffles me, but I mean, most people fit in the Bell's curve, but, it is those cases, and, we have people taking so many things and putting in their bodies and stuff like that, and I think it plays a big part. Uh, I will give you this little tidbit, like, if we have an implant fail, then we probably should do it for every patient. We just really do it for bigger cases, more than 2 implants, but we check vitamin D, and it has significantly, been
Mhm.
a factor.
Yeah.
Like, I would say probably 75% of the people that have a failed implant, their vitamin D is low.
Yeah.
Uh And then, you got all the other factors. You have diabetes, and just 'cause diabetes or hemoglobin A1C is in range, I think it still can impact some people. It's just like the smoking
Yeah.
effect. Somebody could smoke a half a pack of cigarettes and their implant looks perfect, never have any issues.
Right.
But you can have a person that smokes one or not at all and still have issues.
Yeah. Um, yeah, I have vitamin D. So Bashara and Picos did a little article of all places. I think it was in Dentistry Today or somewhere.
Right.
Not like a highly, peer-reviewed journal or anything, but they talked about that. Um,
Yep.
I
And
think I've been prescribing vitamin D. So when my patients accept implant treatment, they instantly get vitamin D prescriptions pretty
right,
much. I mean, you can't really get a toxic dose of vitamin D at the levels we're giving
right,
it. So
correct.
I'm like, I don't even test it anymore. 5 years ago, we were talking about testing it. Now I'm
Right.
just like, "Hey, you're gonna take vitamin D for until the implant's restored, and then you're
That's
gonna go get it from your physician, not me."
right, right. You know who
Yeah.
told me about that too?
Who? What?
Pika.
Oh,
I
yeah.
saw I saw him in the airport one time. I think we were going to the same place, and you're just talking to the legend, the god of oral surgery,
Uh-huh.
uh, and he was telling me about. I was like, I think I was like, "Hey, I had this implant issue or problem," and he was like, "Did you check vitamin D?" I was like, "No." And I came back home, checked the lady's vitamin D, and it was like 16, something crazy. And I knew I had done every single thing I possibly could have.
Yeah.
We switched it and it worked like magic. It was like, okay, this thing has something to do with it. So yeah,
Yeah.
vitamin D is a big deal. And
Yeah.
people like argue against me, like, why are you doing that? I'm like, guys, just read the research is out there.
Yeah. And it does I mean, I hate saying making comments like this in medicine, but how can it hurt? I mean,
Right.
how can a little vitamin D hurt?
Exactly.
I've been asking that question for a long time. I have yet anybody to challenge me on that. Um, because, you're just given such a small dose for weekly for 4 months until it integrates and you restore it,
Correct.
or through the bone graft and then 4 months, so 8 months maybe.
Right,
Um,
right.
yeah. It's
Uh,
funny because 70 some percent of the population of the United States is deficient, I think.
yeah, exactly. that
Yeah.
matches up with what I get as far as a failure too. It's like, if it's a failure, vitamin D is 70% of the time low.
Yeah. Do you ever going back to peri-implantitis, looking at this image, I had this up on the screen for a little bit. You
Mhm.
know, I learned so much in through the 2000s with, implant crustal bone loss, and I've got a longer story on this where I challenged a bunch of the old guard on this back
Right,
when I was before my time, before I even knew what was up, right? You know,
right,
as they say, I didn't know what I didn't know. But I noticed the engineering was a problem in implants, but also I started to notice how, like in here, that
right.
the bone always paralleled the crown abutment shape. Like you
Correct.
see this here
Yep.
and you see this here. I think I was noticing that trend in 2008
Right,
maybe, and I didn't even know why, but I was like, "It's funny." It's like so even before they came up with the concave profiles, I was
right.
noticing that trend, and would you consider, when you're treating a peri-implantitis, convincing them to change out the prosthetic?
Yes, I just had a case today, and I was like, "We are not gonna win with this connection that you have with the implant. We're gonna have to change this if you don't want this to be an issue." No, that's all the time. This was a tissue level, I believe, so it would be
Yeah.
difficult to
Oh,
check that one out, but,
yeah, yeah, true.
yeah, I see it all the time. I hate time-based when especially I'm like, "If you don't get it, make sure you get the highest one."
Yeah,
Take it away because it's too close to the bone. It'll cause, peri-implantitis easily, like,
yeah, yeah.
it I know the
Oh,
labs kinda dictate a lot of the stuff, but, uh, I actually like I said, I actually had a patient this week, and I'm like we had treated it, and it was fine for a year, and it started coming back as far as, I think it's peri-mucositis, and it's like, "You're getting stuff trapped in there, and I'm showing you the design of this crown and where this abutment is." And that's the biggest issue. So it's like, you know what, I want to take it off and we could like try to modify it, but you might have to get a new crown on this thing and
yeah,
a new abutment attachment to it.
yeah. I think that's important. The tie bases you brought up important. I just hired a new associate as a prosthodontist.
Oh, nice.
He sent me a picture of a implant not doing well, and it is on and it's in my practice, and it's on a .08 tie base.
Oh,
And yeah, so when I first switched over to the Neodent brand back in
right,
2017 or 18, I had some crowns come back on .08 tie bases, and before I really realized, it took a year or so to start seeing bone loss,
right,
and yeah, and I was like, "Oh my god, it's all on those .08s," and I'm like, "Duh," it's like, we need a biologic width, we need
right,
1.5, 2.0 to 3.0 even better,
correct.
and now I restore almost everything on a long profile abutment or a custom
Right,
abutment. I I
correct,
I do not like tie bases, and I called that company, another company, I said, "Throw away your .08 tie base, stop selling it,"
right,
right?
right.
And
If
so
it's with you,
yeah,
because
but, I mean, you've seen that, I guess, true?
oh my gosh, so many times. Do you get away with it? Yeah, sometimes you get away with it, but that's a lot of times, when they come in, I'm like, "This is not gonna work." I can do whatever I want to it. It can come out for a little bit, but it's gonna come back, and it's not gonna be a good situation. And sometimes it's hard to get a good result right off the bat because
Yeah,
it's right there, like, it's bacteria right there.
yeah, yeah.
So, yeah, it's a time base is like a paradonta's nightmare.
Yeah, true. I if I were to get back a crown from a lab on a tie base, I'm returning it. I'm not doing
Right,
it.
right,
And there's a lot of pressure too with, dentistry with the screw everything the feeling that everything has to be screw retained,
right,
right?
right.
And angulated screw channels. Uh,
Yep.
you had much experience one way or the other with that, with angulated screw channels and tie bases?
Yeah, with the like I said, with the tie bases, I only know that component of it, that it's just invasive biological width because of an
Yeah.
issue. A lot of times it can lead to peri-implantitis. As far as angulated screw channels, yes. I like screw retain just because if you don't know how to clean the semen off, you don't know how to clean it off, and if you don't have the
Mm,
right tools or you're not skilled in that area, don't use cement, if you don't have to. In most of the cases, you don't have to unless it's misalignment or misangled. And yeah, I'd rather have the screw retain.
Yeah.
But I think you have to do it all the ways. No, I know patients hate that feeling on those anterior teeth. Like they can feel the access hole. And so, uh, or is angled and you have to cement it because access hole's coming out the facial. And I don't really have too much experience like it's causing any issues with the angled screw channel. How about
Right.
yourself?
Well, ASCs, so tie bases on ASCs are traditionally, I mean, they're kind of short usually.
Right,
And you see a lot of debonding of superstructures on those.
right,
So you've got to be prepared for that. If you're gonna speak into the general population out there, not really you, but if you're gonna put everything in a screw retained restoration, you're probably gonna set yourself up for some debonding of some superstructures, especially in the anterior. I found that out the hard way because you got such a short retentive mechanism, and then you got all these shearing forces and lateral forces on your anterior teeth. And
ex-
patients come back and they've got that crown in their hand sometimes. So, I personally, I've gone back to more of the cement retained restorations with the custom abutment. I think it's
right.
better for the bone, and I can clean up the cement, and I'm not gonna probably see that crown come back.
You definitely have to have a custom abutment as well. That definitely helps a ton
Yeah,
on those.
absolutely. Who's restoring? Are you restoring as well in your office?
Generally not. Generally
Yeah,
not. It's the referring doctors, and so that makes it a little bit more difficult as far as control. But that's
yeah,
the way it is, and that's how it goes. But I do get the component what you're saying about the AC,
yeah,
ACS. They are shorter normally, and they can debond from that restoration, which could be his own nightmare.
yeah. Yeah, I just anytime, you're gonna say, someone's gonna say, "I always do this," you just know that
Right.
occasionally there's gonna be a problem. Let's look
Yeah.
at this all on 4. I know this was done by a periodontist because we saved the bottom teeth. Congratulations.
Oh
Uh,
shoot.
I've got no problem with that. I'm just in this world of all on 4, people are, like, so quick to pull them out, and you got a pretty good stable periodontal base here, so I commend
Right.
you on that. That's good.
No, like if I get saved the arch or I think it's a chance, I mean, sometimes it's just not possible, but if I think I could save it, it's just the proprioception and patients complain when they have the zirconia against zirconia and they're like, yeah, it's clicking. I'm like, do you want teeth or what? You're killing me right now.
Yeah,
If I could do it, I can, but that's not always possible. It just depends on patient's hygiene, how they got to that spot in the first place. Did they have decay or did they have perio and
yeah,
certain situations like that? So
yeah. I know, these are big judgment calls. I think that, the case turned out great, guy looks natural, realistic, right?
yeah, it was a good.
Um, He's probably pretty happy with it.
Yeah, yeah, it was. It's few and far between patients that say they're not happy with the full arch, to be honest, from what I've seen,
Yeah,
unless it was, I mean, I really don't hear that. I've had one patient that was like, yeah, I wish I didn't get this. And I was like, really? Like, really needed it.
yeah,
And it was the old style where we were using like the denture and trying to, it was, what is it, FP3, and it was a lot of material. So it was just trying to get used to it, I guess.
yeah.
But I try to make it minimal. I try to do the FP1s if I can, if it's ideal for the case, depending on the situation.
Mhm,
Uh, Patients tend to do a lot better with those cases.
yeah. No, I mean, if I can count on half of one hand how many people say they wish they didn't do it, and it was
Right.
always, well, first of all, I think that goes back to my analog days where it took a year to finish a case and
Right.
20 visits, but a lot of times it was a head case too. The patient was not the right psychological profile to go through comprehensive work. I was, backed up against a corner. And like, these days I'm just more likely to say, your alternative is dentures, you
Right.
know? Like and I use this a lot. I say it's only 2026. Like we're still in the medieval ages. We just got through the bubonic plague. Like it's with dentistry, it's not your natural teeth. Like this is the best you can get.
Right.
So I apologize on behalf of all of humanity that we're not there yet.
Not
you
growing
know?
teeth like a little garden.
Yeah.
I know, it's crazy,
It's unfortunately you just gotta sometimes you gotta reel people back in.
oh my gosh, and I was just talking about that with I think an employee, and I was just like no, it was a doctor coming in, and I had this one lady that came in, and it was like when we were still doing analogs, and she has some kind of bone disease, and she knew it, and, they come out of sedation, and she gets home, and she's like, "Ah, my teeth are, got an overjet," and I was like, "You were over close in the first place."
Uh,
I was like and she was really religious, and I was like, you take it a lot more personal when you're involved in it, and
uh,
so, I don't know, I felt myself getting upset because I knew how hard that case was, like,
yeah.
I probably put 12 implants in the lady and ended up with, like, 7.
Yeah.
Because they're, like, trading them in and now you're trading them out, putting bigger ones in and I was trying to let her because she did not wanna leave without teeth, and I was trying to make it so she could get what she could leave with teeth.
Yeah.
And I could probably count on, like, one hand that I haven't said I normally could tell a patient, "Hey, we're not gonna be able to pick it up," or, "We are gonna be able to," and I knew she really, really wanted these teeth.
Mhm.
And so we got it done. She comes in for the little check, and she's complaining about it, and I was like, "You believe in God, right?" And she's like, "Yeah." I was like, "Well, this was a freaking miracle that we got this done." I normally don't get like that with patients,
Uh,
but I was like you don't even know how hard this case was. I had the lab tech down here, and we were just, like,
yeah.
grinding through this thing.
Yeah.
Oh, man,
This episode of the All In All NX Pod is powered by JB Dental Lab, your full arch lab partner for predictable, beautiful, and digitally precise results. From provisional same-day conversions to final zirconia, JB delivers consistency, communication, and craftsmanship that elevate your practice. The proprietary case portal keeps your team connected with quick communication and real-time updates, while their in-house designers and comprehensive full arch services ensure precision from conversion to final zirconia. If you're looking to grow your skills, JB's Educational Center hosts hands-on courses with live surgeries. Ready to streamline your All NX workflow with a lab that truly understands the surgical and prosthetic connection? Visit jbdentallab.com and tell them the All In, All NX Pod sent you. Thanks for listening.
was crazy. She actually this is one that was a case I did wind up restoring because she went to the general dentist, and I don't work with him that much, and I told him that guy had, throat cancer, actually.
Okay.
Uh, I went to told the general dentist, "Hey, use this lab because they really know they've been following this case and they know what they're doing. Like they are the top notch one that we have here that's local that's going to be able to help you out with this case." He used some other lab. Like I said, she was one of those patients, and she came back fiery, angry, like a demon out of hell.
Oh,
I was
jeez.
like, she was like, "You have to fix me." I was like, I really don't wanna do it, but you know what? I'm not gonna let you hang in it. It looked horrid, and so we wound up fixing the case and,
Yeah.
uh, getting it done with the lab, and yeah, it wound up turning out pretty good at the
Yeah.
end of
I'm sure it did. It's hard because I'm a GP, but I get referrals,
right,
and about half my business is by referrals. I've got a few oral surgeons that send here, a couple
right,
prosthodontists, but some GPs, and sometimes when the GPs want to restore it themselves, they don't understand the pros and the vertical, and
Right.
those are the hardest cases that I
Correct.
have. And I'm just like, just give me let me just finish it.
Right.
Like, I can finish this in like 3 weeks,
Right.
like we'll be done with this case. Um, but I'm not trying to discourage anybody from doing this, but these are complex cases. And so what I'm
Right.
saying is somebody that's in your position where you're getting referrals from all corners of Wichita, right? Like
Right.
various levels of experience and knowledge and this unawareness of the complexity of these cases,
Right.
right?
Right. Like people, specialists, are like, man, look at these GPs doing these implants. I was like, I think it's the best thing. I was like, first thing they know what the difficulties are. And if you do have an implant issue, they're like, well, I had one too. You know what I mean?
Yeah,
Second thing, they're able to see it better than somebody that doesn't do implants. They're like, okay, this person needs a sinus lift, or this person needs an
yeah,
implant, or they're gonna
yeah,
sell the implant more
yeah,
than somebody that just does traditional crown and bridge.
yeah.
Um, so I think that helps. It is a lack of it's a fear of doing these cases as well. I have some that's like, "I don't wanna do it, you could finish it out." I have some that's like, they wanna do it, and, you get a prosthetic screw broken, it's like, "God dang it. Imma have to replace this whole multi-unit abutment, it's $250 or whatever it costs, and
Hmm.
take this off," or, it's just it's room for education, and I think because they don't do as many, is that they don't invest in maybe some of the CE education for it. And
Hmm.
so, I mean, I try to do some of those educational courses. It's just trying to get everybody to it because everybody has these cases in their practice, and they are, for me, they're super fulfilling. At the point of the time of analog, I was like, I'm losing money doing these cases, but it's so like
Hmm.
impactful to people's lives that I get the joy out of it. And we've went to digital, we got the photogrammetry and all that other stuff, so it makes it really smooth
Yeah.
and time efficient. But they don't, like you said, they're not introduced to these cases very often, so it makes it intimidating for them, and they can make a lot of mistakes with it that they're not looking at, or they might not understand it, or they might have a lab that they're using that don't understand how to design them, which becomes it can be a hiccup later on.
Right.
And so it's just figuring out those cases. This little lady right here would barely even talk to me. I think she was told by several dentists that she had a drug problem or when is she
Mhm.
gonna stop doing meth? And she probably for 4 months she smoked too.
Mhm.
So this was one of those cases I didn't pick up right off the bat. And
Yeah.
and she hated it, and I was like, "I told you all you gotta do is stop smoking for a couple of months, and we'll get it done," but she didn't want to, and she finally started speaking to me when we delivered those little guys,
Mhm.
and she is the best, like, that was, like, the most impactful.
Sure.
Like, she brought her husband, he was super cool, to 75% of her appointments or,
Mhm.
yeah, appointments. Nitrous at least, if not oral sedation, like, I think we had to let her go because she was so emotional, like, crying and wouldn't open her mouth, and like I said, she wouldn't talk to me, she would write stuff down sometimes
Oh,
to
yeah.
describe what was going on because I was like, is it hurting?" Or like, "How's your bite?" And so, she was one of the reasons why we got a T scan because she
Okay.
could talk to me, so I was like, "Well, at least this digitized information I could get real time will, help." So, yeah, she is
It's one of those people that you say, how's it feel? What do you mean? Is it balanced? I don't understand the question. Do you hit on your right side first, left side first, or both at the same time? I still don't understand the question.
exactly.
I like just start to close and tell me where it touches first. And she's like, It doesn't touch anywhere.
Exactly. Yeah, it's exactly what she said.
You're like, you're like, oh my God. I'm like,
Exactly.
all right, let me just ask it this way. Does it hurt or feel wrong? No, it feels fine. Okay. All right. All right.
Oh, man.
Holding ship stock doesn't hurt. Let's try it.
Right, exactly, man. It was a task, but we got through it, and it was like I said, those are the ones that will make an impression on you and stick with you forever. So
For
yeah.
sure. Well, Mark Q. Mark Q. Uh, I think we've successfully scared everybody about implants with peri-implantitis and all out for psychological and prosthetic challenges today.
Oh man, you're probably right. That was the intent, right? That's why you invited me on.
Uh, well, Harry said you were a funny guy, so I was waiting to hear some jokes.
I'm
And
not funny like that. I'm not the comedian, man. You don't want to hear my jokes.
okay,
These dad jokes I got. I mean, the team makes fun of me all the time. I'm like, oh, that's a cute little dad joke again.
I got my dad jokes here. Here, listen.
I'm reading a book about anti-gravity. It's impossible to put down.
I was given that recently because I'm a new dad.
Oh, that's so cool, man.
That's cool,
Congrats.
yeah.
That's like the most beautiful thing in the world.
I
Congratulations
got my
on
dad jokes.
uh,
But
I was gonna say
the
something
reason
about your name.
what?
I was like, you have to have been called Hulk Hogan.
Oh yeah, can't you see?
I even saw
And
some pictures.
I
I
got
was
my
like,
muscles on this arm. These are my muscles.
exactly. I saw the pictures on your Insta, and I was like, he's kind of stacked. And I was like, man, he had to be called Hulk Hogan. Yeah, Musclemania group out there. I was like, he had to be one of those kids, 1990s, like Hulkamania all day.
Oh man, I didn't pack on weight until I was in my 20s. So I was, I wanted to be a professional football player, but that was a dream because I was like a
Really?
twig, man. I was a stick, you know. I'll tell you real quick. I was a fat middle schooler who was on the offensive line, and we won a
Right.
city championship. And then I went to high school, and I just strung out.
Oh,
Like
really?
I just got like a string bean, man. I just grew like straight up and didn't gain a pound.
Oh,
So,
man. Hey, it's better that way than the other way. You don't want to grow out and not grow up.
yeah, exactly. Right now, I'm trying to grow back in,
Me
just a
too,
little,
bro. Me too.
just a little bit.
Oh,
Um, Shit, this has been great. Saturday morning, I got to let you go soon. Are you teaching? Harry said he heard you at a lecture. Where are you teaching? You teaching anywhere?
I mean, people ask me here and there to do some presentations, and I got one coming up in October, but I don't think I have anything coming up anytime soon. But yeah, I mean, I like to
Yeah.
do speaking
Cool.
engagements every now and then. Nothing too crazy. I mean, I got kiddos too, and I'm running all around with those guys.
Yeah.
Got 2 baseball games in a tournament this weekend and had gymnastics last night. So
Yeah.
I don't do it as much as I would like, but you know,
Yeah.
here and there.
Well, I wanted you on here for a lot of reasons, but one, you're a regular stand-up Joe, like a Peri-Implantitis of Wichita, Kansas, and I mean, I think expertise is not, it's not built on the podium. There's a lot of people that
Right.
just make a living in education, and I think
Right.
you're building expertise. So there's a lot of value in this peri-implantitis lecture that we got, and just in practice in general. So I
Right.
encourage you to get up there and share with other people.
Yeah, for sure.
Sure.
For sure. Any opportunity I get, I'll take it.
Yeah. Let me know if you want to come out and check out the institute one day here in
Yeah,
Virginia
for sure.
Beach. We'll come out for sure. This has been great. You got any other things you want to share today?
Man, no, that's a great podcast, man. I like what you're doing. That's we need more of that. And I've seen some people that I know on your as members of your group. So it's pretty cool that you're spreading the knowledge and they need to. And I think it's cool that you do it in a relaxed environment, like periodontists especially tend to be a little bit uptight sometimes and can scare people off and talk over people's heads. And so having this base definitely helps, like make it real life for people. So I liked what you were doing and what you're doing with it. So kudos
Uh,
to you.
Thanks, man. If there's one thing I excel at, it's being average.
By no means are you average, my man.
I'm
You're the
working on it.
folks.
Elevating for sure.
Right.
I
That's
appreciate that. That's great for listeners. If you guys are enjoying this, please subscribe and check the YouTube out so you can see these images, and subscribe on Pod app as well. And with that, we'll be dropping this probably on a Tuesday coming up soon. So thank you very much for sharing your morning with me, Mr. Mark Hughes Sams.
no, thanks for hanging out, my friend. Thanks
All
for hanging
right. All right. I've got a baby back here, and a wife still recovering from surgery. So I'm going to split. And what are you doing today?
I got 2 baseball games about an hour and a half away, my friend. It's gonna be fun. It's a nice day. So
All right. Enjoy it out there in God's country in Kansas. All right. And
all right, brother.
we'll
You
check in
take it
soon.
easy.
Stay in touch.
All right, take it easy.
All right. You too. Bye.
All right, bye-bye.
If you can place implants but can't scale your practice, this course is for you. Core Business breaks down how to build a 5, 10, 20 arch per month practice, generating millions of dollars of revenue, learning systems, teams, marketing, and leadership. Stop guessing, start scaling. Core Business, how to 5, 10, 20. One time only, April 24 and 25, 2026.